Today I want to do a brief video on yoga and hypermobility. This is oftentimes a question that I get asked because either people who are hypermobile really tend to gravitate towards some yoga type activities, or they've been warned to stay away from it. So let's break this down for a moment. People with hypermobility spectrum disorder, and that can include Ehlers-Danlos syndrome or just the hypermobility spectrum disorder. We tend to have some deficits in the area of what's called proprioception, or our brain's ability to tell us where in space our joints are at a safe and optimal position to function. So if somebody goes to a yoga class who is hypermobile and they are not familiar with kind of their positioning, their body's positioning in space, then they are at risk of injuring themselves because of the positions that yoga puts the body in. However, it can be used as an excellent way to teach proprioception to people with hypermobility. Usually that would come with a skilled instructor who is aware of some of the things around hypermobility so that those particular things can be cued with a position. So let's break this down for a moment and use a particular yoga pose for an example. So we have our triangle pose as one example. So let's say somebody is hypermobile, they're coming into a triangle pose. And if they're not cued and on kind of how to position things, and they're not all that in tune to their body in space, which a lot of people are not naturally, when we get into that triangle pose, let's just take this for a moment. With hypermobility, we may be tempted to hyperextend that knee and kind of snap it past where it should go because we have that mobility. And then we may tend to hang out on the ligaments supporting our knee so that it doesn't continue to go all the way. In the case of hypermobility, we want to cue this person to maybe even unlock the knee a hair and then work to fire all those muscles around the knee joint to eccentrically stabilize that joint in that position in space. By eccentric, I mean the muscles are lengthened, and now we want to teach them to contract and to support that joint in that particular position. And so then as the individual in that position, I can feel, hey, this is hard, this is safe. If I go past that, I'm kind of hanging out on ligaments, and it's easier, but it's not so good for my joints. So we can use this as a real brain training mechanism. So the knee is one example. The other example in this triangle pose would be your outer hip. So if we are not cued to engage that gluteal muscle, we may be tempted to kind of jut that hip out, hyperextend the knee. Now we're hanging out on several ligaments on a couple different joints here. So we want to cue this positioning, keep that muscular activation around the hip joint, support and stabilize around the hip joint in that position, and then let your brain feel that and feel that that's a safe position. So those are two joints in the triangle position that come to mind. Another position that we could use to demonstrate this example of hypermobility where somebody might go beyond their range of what would be considered safe would be your down dog position. So down dog position, a person who's hypermobile may hyperextend at the elbows, and they may hyperextend at the shoulders, meaning sagging all the way kind of into those shoulders. Now it's one thing to take a stretch in this position, but it's another thing then just to kind of sag. We want to activate the muscles around the shoulder girdle and around the elbow so that we're in a nice stable joint position here. And so we want to cue that. If somebody's hypermobile, we want to make sure that they're not just sinking into this, hanging out on ligaments. We want to cue that they can feel their shoulders, shoulder blades engage. We want to cue the wide finger position. So you're getting some input into the hands And that gives you input all the way up into that whole arm to be able to stabilize and activate muscles. So that's another example of a yoga position where sometimes we'll see hypermobility create some problems for people. So to answer the question of, is yoga a good thing for people with hypermobility disorder? The answer is it depends. It depends on the instructor. It depends on the knowledge of the person who's doing yoga. And optimally, you want an instructor who's aware and can cue positioning, joint positioning in a way that the person doing the yoga can use that as a great learning tool to learn body positioning in space and to really strengthen muscles around joints in a lengthened position. So their muscles are going to be in a lengthened position, and then they want to learn to stabilize around those joints. Okay, hopefully that helps spark some thoughts for some of you who have this question about whether yoga is safe for people with hypermobility.